some point during the COVID-19 pandemic, when only 3% of Nigerians had received full COVID-19 doses, the country destroyed 1 million of such doses of expired vaccines. A month after getting rid of a large portion of its vaccine supply, Nigeria secured the help of the private sector for ultra-cold storage facilities to store and distribute a new set of vaccine. For a time, this was a critical issue in many countries across Africa. In fact, about 2.8 million doses of the COVID-19 vaccine expired before they could be used. This after months of lobbying richer countries to share their vaccine supply. While the short life of vaccines didn't help, Africa's struggling healthcare industry exacerbated the situation. We didn't have the right distribution or storage facilities, we didn't have the right infrastructure, and we didn't have a vaccine manufacturing capacity. But it's not all doom and gloom. On the contrary, COVID did not devastate Africa as many predicted. In fact, it compelled much needed innovation, especially in the health tech sector. Hi, I'm Tandani. Welcome to this Debating Africa podcast, or Debatecast, if you will. I am the editor of Debating Africa, and I am going to keep you for roughly 30 minutes. Let's learn some stuff about health tech.
During COVID, Africa was the last to receive PPEs, the last to receive critical reagents to support testing, and the last to receive the COVID vaccine. I mean, this clearly highlighted the need for equity in healthcare globally, not just in the developed world. And I think thirdly, it showed us the resilience of the African continent.
Speaking there is Caroline Mbindio, the CEO of Amref Health Innovations, the branch of Amref that is specifically focused on finding new solutions to existing health challenges. Caroline is an experienced leader in the fields of global health, innovation, technology, and international development, with over 20 years' experience running and growing entrepreneurial ventures in the nonprofit and commercial space. Here she is with more on how tech saved the day.
Almost overnight, we saw service providers embracing virtual technologies in unprecedented numbers. And we saw that these service providers were able to serve their clients within that restriction of in-person interaction. I mean, I could suggest that these things enabled many sectors, not just the health sector, many sectors achieved decades worth of reforms in such a short period of time. And in healthcare, players across both the public and the private sector, they boosted things like their data analytics. They were looking at the number of patients who are coming in, the symptoms that they were showing, and they were sharing those across, the different networks on a daily basis. There were capabilities around consumer behavior, around payment for services, around access to services for patients with chronic illnesses. And the innovations were very pragmatic, focusing on real problems. How do we offer continuous education to health workers? Because they needed it more then than at any other time, because COVID was new to all of us. How do we ensure that patients can continue to access services? How do we do surveillance at the community level? How do we identify and predict where the hotspots are? I mean, we saw use of things like robotics for triage, to control contact, to limit contact, with potential positive cases. We saw online pharmacies, people being able to order their medicines online and get them delivered. We saw that, platforms to enable health facilities to source for critical supplies. Where can we find PPEs? Where can we find oxygen? So all this platform cropped up to address real problems. And this is what innovation is about. It's not about bringing something novel. It is about bringing something novel that addresses real challenges.
A lot more people are beginning to access digital devices to ensure that they access this healthcare. So we are seeing the internet subscription costs go down. We are seeing mobile penetration costs go up. We are seeing connectivity go up. And so what that means is a lot more people are getting connected to the platforms that could enable them take full advantage of digital healthcare.
Stephen Ogweno is the founder and CEO of Stolink Inc. Kenya, an organization that has implemented numerous health programs across 10 African countries. He describes himself as a global health enthusiast and is well known for his work as an advocate and a trailblazer in the non-communicable diseases field. In 2021, he was recognized as one of the top 100 most influential young leaders in Africa. So cool. I asked him to give me an idea of how big the healthcare challenge is in Africa.
The major population of the continent actually still does not have access to comprehensive healthcare. And in fact, when we go to issues of health coverage and universal healthcare coverage, the numbers go to the 70s to 80% of people who do not have access to, comprehensive healthcare. So that if a family that was in the middle class was attacked by a disease, then they would almost fall back into poverty because of lack of access to proper healthcare. And that is how big the challenge actually is.
Let's talk about digital and what it can do to bridge this gap. 80% is a lot of people that don't have healthcare. What does digitization offer us as a continent in terms of addressing this?
Yeah, so digital is really, it's the potential that Africa has as a continent to, as opposed to go through the whole process like most of the developing countries did, where they had, these diseases, and then they had to create systems, and then they had to educate the people, and then they had to, go through the challenges of communicable and non-communicable diseases before they got into the digital healthcare space. As Africa as a continent, we have the opportunity to bypass some of those processes and learn from what already exists, and then take advantage of these digital technologies that exist. With digital technologies, you've seen examples for countries like Uganda, for example. You're able to improve access to healthcare by over 80%. You're able to suddenly connect one doctor to 10,000 clients, which was not the case with the traditional models of connecting people one-to-one. You're able to have people access pharmaceuticals and drugs at the last mile without having them travel to the cities. You're able to have surgeries happen, remotely, and instructors be guided and have those happen without the people enduring the costs of those processes. And also now, interestingly, you're also able to have people engage in preventive healthcare practices, go to the gym, exercise, work out, check on their mental health. And that is the potential of digital health, that it could actually be the avenue that the continent uses to take them, from zero or from 40% of healthcare to potentially 80 and even 100% in terms of getting more people.
And to that point, Stephen is passionate about preventative healthcare as opposed to treating illnesses after the fact. He's designed exciting programs, initiatives, and platforms to do just that. And we'll definitely be exploring that later in the episode. But first, I wanted to find out from Caroline about Amref Health Innovations' work in the tech space and the exciting innovations coming out of Africa overall.
At Amref, we use two technologies, Leap and Jibu. These are platforms that are focused on training health workers wherever they are. And what this ensures is that these health workers can then provide services to populations, whether they're in rural places, urban places, or in the hard to reach remote facilities. They can provide this quality care to these patients. And so far, we have trained hundreds of thousands of health workers across the continent. But if I look at this more from the patient, more from applications that are supporting patients, we have numerous technologies. We have a platform called Afya App. And this Afya App uses artificial intelligence. It uses behavioral science to help patients who have chronic illness. How do they change their habits? How can they reduce their financial burden? How can they better manage their condition so that they can improve their own health outcomes? There are applications such as Babel in Rwanda that support diagnosis of many medical conditions without requiring the patient to visit a physical health facility. Of course, we have the drone company Zipline that ensures that patients in the most rural and remote parts of Rwanda, in Ghana, are able to access essential commodities and medicines. We have the Zuri platform, which is a virtual mobile fast platform that helps patients quickly and easily access healthcare from certified patient providers based on availability of those providers, based on their location and based on their specialization. We have the Omoni platform, and that is focused on pregnant women and mothers with children under 5. And it provides them with access to both health information, but also enables moms to monitor their children's health until they're at the age of 5, which is a very critical period of development for children. We have applications like Mydawa or Sehatuk, which provide huge databases of medicines along with their prices and facilitates ordering and fulfillment. We have Mtiba, which is a mobile platform that connects their members to healthcare providers and to payers to make healthcare more transparent, more efficient, and more affordable. I mean, I could go on and on. There are numerous platforms, numerous innovations from within and outside the continent that are addressing the health gaps, particularly for unserved and underserved populations.
So I did a little Google and was blown away by an article by the Africa Report highlighting the, and I quote, major startups revolutionizing Africa's health tech. These startups are founded on what Caroline spoke about earlier, which is addressing real challenges through novel ideas. I'll call out a few. A general practitioner from Benin named Cedric Degbo created a social media platform where medical practitioners could exchange their knowledge to prevent medical errors, which according to him result in more deaths than from malaria and AIDS combined in Africa. The platform is called REMA, and that's an acronym because I will not attempt the French pronunciation, and is currently used by more than 7,000 doctors across West Africa. Elsewhere in Cameroon, there is a 29-year-old innovator named Elaine Tiff. He runs 2 e-health startups. One of them is called Gifted Mom, which aims to reduce infant and maternal mortality rates in developing countries through a service that monitors pregnant women via SMS and voice messages in English and French. Now, this is just like 2 of the 5 that they highlighted. I will leave a link to that article below. But back to Stephen, who's focused his ideas and passion towards tackling non-communicable diseases. The term refers to a group of chronic conditions that are not mainly caused by an acute infection. So they result in long-term health consequences and often create a need for long-term treatment and care. So we're talking about your cancer, your chronic lung illnesses, and diabetes. So his work centered around education and prevention.
Can you please talk about what you identified and the solutions that you've innovated through your company?
Yeah, so I'll talk to this bifold. So first I'll talk about our work with Stowen, which has really been one of the pioneering organizations when it came to digital healthcare in the non-communicable diseases space in Kenya. So non-communicable diseases and climate change have been termed by the UN as the 2 leading challenges of the 21st century that we need urgent solutions to. And the reason why is globally, 3 out of every 4 people are already dying of non-communicable diseases. Now, locally, it's 3 out of every 5. But interestingly, 55% of all hospital admissions at the moment is also because of these diseases. And then we start to analyze and see where is the problem. And when we started to look at that question, we found out that the problem existed in threefold. That one, people do not even understand what these diseases are. People still think that cancers, for example, are diseases of the old and the rich. People do not know what caused these diseases. People do not know how to prevent themselves from these diseases. So then the awareness and education bit becomes a key component that needs to be addressed. And then coming out of that, then you begin to see what else do people see? What else are the challenges that exist in the space? And then you'll find that healthcare systems are fragmented, and there is only a very tiny majority that is working on the non-communicable diseases space as an issue to address. So then we started to ask our question, how do we bring these people together to ensure that the end users are able to access these services, able to learn, but also able to know who are the few that are already working space. So then at Storyling, we developed the NCD 365 mobile application, which is a free mobile application to help people learn about non-communicable diseases, to help them know relevant events and activities that are happening that relate to non-communicable diseases, to connect them to various organizations and institutions working in the non-communicable diseases space, and then to provide them with toolkits and resources to help them learn and improve their knowledge on non-communicable diseases. So we created that as the first bit of our sort of digital health revolution in the NCD space. And then further than that, then we've been able to bring in social media and use that as a tool to amplify the work on digital healthcare. We've been able to create online courses as well to educate, community health workers, trainers, young people to learn about non-communicable diseases and then pass the information. So we've been able to find different ways to leverage on digital technologies, right from what is already existing to creating new platforms like the NCD 365 app to ensure that people are aware of these diseases, and then people are able to begin to act. And then once people are aware, the next question is, what are the next steps? How do we then begin to take action? And that is now where I'm currently at the moment with digital health, where we have developed Lifespan Health, which is now a health tech startup that is looking at getting people to the next stage, which is improving their behavior to ensure they prevent these diseases from the onset. So we do not want to prevent non-communicable diseases once people have had them. We want to ensure that we get people before they have them, to ensure that they are able to develop the right behaviors, the right living habits to prevent these diseases.
And so what's the adoption rate here? You're telling people to eat salad over a burger. It's a hard message to sell.
Doing things that make you healthy is always perceived as boring, because if you want to drink smoothies every day and you want to go to the gym every day and you want to educate yourself, then those are sort of boring activities. So how do we make them fun and interesting? And is where we've now started to bring partners together to then tell people that, hey, if you practice this set of physical activities, mental health, nutrition, then we reward you for it. We reward you for being healthy. And how we reward you for it is through discounts and offers and subscriptions from our other partners that have been isolated for the longest time in the healthcare space, to then connect the users to gyms, connect users to nutrition services, connect the users to mental health services, and then ensure that we're bringing this ecosystem of individuals that are actually actively working towards improving their health lifestyles and ensuring that at the end of the day, we're able to prevent the rise of non-communicable diseases. What we're developing now, incentive-based healthcare programs. And the reason why that is really exciting to me is that for the first time, we are beginning to, Vitality Health actually does that in South Africa, and then now we want to expand that across the continent, is to get people excited about being healthy, and not just focus on the innovation that solves healthcare problems once people are sick. So, for example, we don't want to give people medicine once they become sick. We want to help them not become sick. And seeing the movement that is currently happening towards ensuring that innovation that tackles people's behavior is coming up is very exciting. And I'm happy that I'm part of the pioneering spirits that are getting that innovation happen in the continent.
Perfect way to end the interview. Mm-hmm. Stephen, thank you so much for taking the time. I know it's been a crazy day.
Yes, thank you very much for having me as well. A lot more has to be said, and hopefully we can do this again in the future. But
absolutely.
Yeah, thank you.
All right then, take care.
All right, take care, and bye for now.
Bye for now.
Shout out to Stephen, man. Before I let you go, let's quickly look at what's needed at a policymaking level to support and safeguard health tech innovation, certainly with the aim of preparing the continent for any future global health emergencies. As you've been listening to tech innovations and new apps, you may be wondering, well, what about people's privacy and medical information? Once you hand over an interpersonal interaction to the digital realm, there are a lot of implications.
My name is Stuart Morrison, and I am a master's candidate at the University of Witwatersrand. And my story about accessing healthcare or using technology to access healthcare kind of revolves around this growing industry of having mental well-being and mental health apps and, these online platforms. And I think there's a lot of problems with using these type of apps and these online platforms simply because there is a huge risk of misdiagnosis, because a lot of emphasis is on the patient themselves to do the diagnosis. And you kind of have to, based on, what you're feeling or, thinking or what your symptoms are, they aren't unpacked with a trained professional or expert. And so I think there's a lot of dangers in terms of misdiagnosing any issues that you might have or giving you wrong information about how to improve your mental well-being. And I think an important part of improving your well-being is engaging with people. And I think psychologists play a very important role. And I don't think that this can be replaced or changed by an app or an algorithm or an online platform.
And during COVID, and even before then, we have seen increased interest from the health sector in things like artificial intelligence, robotics, wearables, etc. And these technologies are technologies that leverage big data, and they connect the physical world and the digital world. But these technologies, they pose a threat to patients and to populations in general. The private sector is implementing a lot of these innovations, and their implementation is outpacing the development of regulatory systems, of standards, of ways of mitigating the risk. We have organizations who are interested in global cybersecurity, internet governance, but all of these are fragmented, even across, as you move from country to country and continent to continent. There are no global or local frameworks that control this digital technology, and the cyber attacks, they're all very localized. In many cases, we have digital dominance increasingly seen in both economic And they provide an economic advantage to organizations. So there is an incentive for organizations to collect data without necessarily providing for the security of the person, but also for national security of countries. There is definitely a need to harmonize policies on data governance, particularly around health data. So that is one. The second one, I would look at local investment in innovation. As I said that during COVID, we saw a move towards nationalism, and we saw that that significantly disadvantaged the African continent. Is it possible for us to drive investments, particularly from local public and private sector funds, to support health innovations in Africa, for Africa, by Africans? That is something that we need to look at. And I would say the third is around ESG, environment, social, and governance policies, which focus on equity in access to medicines, equity, particularly in cost-effective medicines. Most of the time, we see that the cost of medicines in Africa is higher than anywhere else in the world. Yeah, and investing both in the medicines that come from outside Africa, but also in developing generics within the continent. How do we put policies in place that drive that, so that when the next pandemic is coming, and for sure it is coming, we are already seeing monkeypox, we're already seeing Ebola, so we need to be prepared now before the next pandemic.